HIV/AIDS by Jennifer Begier, Navjeet Dihla, Amandeep Gill, and Jessica Sabatte. HIV versus AIDS. HIV stands for Human Immunodeficiency Virus, and AIDS stands for Acquired Immunodeficiency Syndrome. AIDS is the final stage of HIV, and not every individual diagnosed with HIV gets AIDS. Infectious agent. HIV is a single-stranded, positive-sense enveloped RNA virus in the genus lentivirus. Prevalence. Prevalence refers to the number of people living with HIV/AIDS at a given time. In 2012, an estimated 35.3 million people were living with HIV/AIDS. Mode of transmission. HIV can be transmitted through sexual contact, needle sharing, medical use of blood, organ, or tissue transplantation, or through artificial insemination. For pregnant women, HIV can be spread to the child during pregnancy, birth, or through breast milk. Host. HIV targets and attaches to T cells, specifically the CD4 receptors. 2/3 of the peripheral blood T cells are CD4 receptors. HIV then replicates. The HIV life cycle is complex. Why should you be concerned? When HIV destroys so many of your cells, you develop AIDS. More than 1.1 million people in the United States are living with HIV. 1 in 6 are unaware of their infection. There are 50,000 new infections of HIV every year in the United States. Incubation period. 2 to 4 weeks after infection, people can experience flu-like symptoms. Acute retroviral syndrome, or primary HIV infection, is the body's natural response to HIV. HIV can be detectable after infection within 2 to 8 weeks. In most persons, the virus can be detected with an RNA test within 9 to 11 days after exposure. In some cases, it may not be detectable for 3 to 6 months. Symptoms. Some symptoms people may experience, but not all people develop symptoms for HIV are fever, swollen glands, sore throat, rash, headache, fatigue, muscle and joint aches. For AIDS, rapid weight loss, reoccurring fever, profuse night sweats, chronic fatigue, prolonged swelling of the lymph glands, sores of the mouth, anus, or genitals, impaired immune system. Many people don't have any symptoms for up to 10 years. Symptoms alone do not mean HIV/AIDS. Other illnesses can cause these symptoms. The only way to know for sure is to get tested. Testing and diagnostics. The ELISA test is used to test blood for HIV antibodies. After 2 positive ELISA tests, a Western blot is performed. Polymerase chain reaction is useful in detection of recent HIV infection. Testing is often done in intervals at 6 weeks, 3 months, and 6 months after exposure to find out if the person is infected with HIV. Treatment. There is no cure for HIV/AIDS. Antiretroviral therapies can be used to slow down the rate of progression to AIDS. Treatment of side effects. HIV/AIDS weakens your immune system, causing an increased risk for opportunist infections. Methods of control. You can protect yourself by educating yourself and others about HIV/AIDS, knowing the HIV status of your sexual partner, using a condom, and getting screened regularly. There are 2 HIV vaccines currently being tested. Antiretroviral medications can reduce the risk of transmission. We just wanted to let you know that no one is safe. It's a common misconception that HIV/AIDS doesn't happen in the United States, but it can happen to anyone, anywhere. Thank you for watching.